Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Digitoxin in patients with heart failure and reduced ejection fraction. Background. The therapeutic efficacy of the cardiac glycoside digitoxin in patients with heart failure and reduced ejection fraction is not established. Conclusions. Treatment with digitoxin led to a lower combined risk of death from any cause or hospital admission for worsening heart failure than placebo among patients with heart failure and reduced ejection fraction, who received guideline-directed medical therapy. Next, apixaban for extended treatment of provoked venous thromboembolism. Background. The appropriate duration of anticoagulation for venous thromboembolism, VTE, in patients who have a transient provoking factor, for example, surgery, trauma, or immobility, and concomitant enduring risk factors is uncertain. Conclusions. Among patients with provoked VTE and enduring risk factors, low-intensity therapy with apixaban for 12 months resulted in a lower risk of symptomatic recurrent VTE than placebo, with a low risk of major bleeding. Next, measurable residual disease-guided therapy for chronic lymphocytic leukemia. Background. An interim analysis of progression-free survival in this trial showed that ibrutinib venetoclax was superior to fludarabine cyclophosphamide rituximab, FCR, among patients with chronic lymphocytic leukemia, CLL. Whether ibrutinib venetoclax is more effective than ibrutinib alone is unclear. Conclusions. With extended follow-up and increased enrollment, our trial showed that undetectable MRD and extended progression-free survival were more common with ibrutinib venetoclax than with ibrutinib alone or FCR. The results for overall survival were also consistent with the benefit of ibrutinib venetoclax. Next, early tirofiban infusion after intravenous thrombolysis for stroke. Background. Intravenous thrombolysis remains a standard treatment for acute ischemic stroke within 4.5 hours after onset. Vascular reocclusion may occur after intravenous thrombolysis and may be preventable with an antiplatelet agent within the first 24 hours after thrombolysis. Tirofiban, a platelet glycoprotein IIB-FIA receptor antagonist, has reduced macrovascular reocclusion in experimental models. Conclusions. In patients with acute ischemic non-cardioembolic stroke who underwent thrombolysis within 4.5 hours after onset, early tirofiban increased the likelihood of an excellent functional outcome. The incidence of intracranial hemorrhage was low but higher with tirofiban than placebo. Next, we will be discussing articles from Journal of American Medical Association. Levodopa added to stroke rehabilitation. Question. Does levodopa therapy added to standardized rehabilitation improve stroke recovery compared with standardized rehabilitation alone? Findings. In this randomized clinical trial, including 610 participants, motor function at 3 months, measured by the Fugel-Meyer assessment total score, was not significantly different between the levodopa plus standardized rehabilitation group, compared with the placebo plus standardized rehabilitation group, median, 68 points versus 64 points respectively. Adjusted mean between group difference, minus 0.90 points, meaning these results do not support routine use of levodopa for motor recovery in unselected patients with stroke undergoing rehabilitation. Next, we will be discussing articles from Annals of Internal Medicine. Palliative Care Educational App for Family Caregivers of Homebound Patients with Incurable Cancer, a single-center randomized trial. Background. Home-based palliative care relies on empowered family caregivers to overcome the limited availability of palliative care professional resources in managing incurable cancer. Conclusion. The Palliative Care Educational App through WeChat improved HERCL among patients with incurable cancer at 2 months. This finding has implications for future study and development. Next, we will be discussing articles from British Medical Journal. First, mammography screening participation and breast cancer incidence and mortality in the subsequent 25 years. Objective: to determine whether women who did not attend their first mammography screening invitation have a long-term risk of poor screening adherence and breast cancer outcomes. Conclusions: this study shows that first screening non-participants represent a large population at long-term risk of dying from breast cancer, providing an opportunity for targeted interventions to improve adherence to screening and thereby decrease mortality risk. Next, we will be discussing articles from Lancet. Minimum effective low dose of antithymocyte globulin in people aged 5 to 25 years with recent onset stage 3 type 1 diabetes, MELD-ATG, a phase 2, multi-center, double-blind, randomized, placebo-controlled, adaptive dose-ranging trial. Background: type 1 diabetes remains an important healthcare problem, with no disease-modifying therapies available in people with recent onset, clinical type 1 diabetes. Adaptive trial designs, allowing faster evaluation of treatment modalities, remain underexplored in this stage of the disease. We aimed to identify the minimum effective dose of antithymocyte globulin, ATG, in people aged 5 to 25 years with recent onset, clinical type 1 diabetes. Interpretation: in young people with recent onset, clinical type 1 diabetes, 2 middle.5 mg/kg and 0 middle.5 mg/kg ATG, reduced loss of beta cell function, showing the potential of an affordable, repurposed agent, ATG, in a low and safe dose, as a disease-modifying agent in this population. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Ribociclib plus endocrine therapy in hormone receptor positive/ERBB2 negative early breast cancer. Question: is the efficacy benefit of ribociclib sustained beyond the planned 3-year treatment duration for patients with hormone receptor positive/ERBB2, formerly HER2 negative early breast cancer in the NATALY randomized clinical trial? Findings: in this exploratory 4-year analysis of 5,101 patients from the NATALY trial, ribociclib, plus a nonsteroidal aromatase inhibitor, NSAI, continued to demonstrate an invasive disease-free survival and distant disease-free survival benefit over NSAI alone by reducing the disease recurrence risk by 28.5%. The absolute IDS benefit continued to increase from 3 to 4 years, meaning NATALY results continue to support the benefit of adding 3 years of ribociclib to adjuvant NSAI in patients with hormone receptor positive/ERBB2 negative early breast cancer at risk of recurrence. Next, we will be discussing articles in the field of rheumatology. Severe maternal morbidity during and after pregnancy among veterans with systemic lupus erythematosus or rheumatoid arthritis. Objective: to describe severe maternal morbidity, SMM, among veterans with systemic lupus erythematosus, SLE, or rheumatoid arthritis, RA, who use Department of Veterans Affairs, VA, healthcare. To our knowledge, this is the first study of SMM among veterans with SLE and RA. Veterans with SLE appear to have an elevated risk of SMM, and veterans with SLE and RA appear to have high rates of pregnancy loss. Our findings highlight the potential utility of comprehensive maternity care models for these veterans with SLE and RA within the VA healthcare system. Next, we will be discussing articles in the field of cardiology. Here are the articles from Journals of the American College of Cardiology. From JAMA Cardiology: Institutional variability in processes of care and outcomes among patients with STEMI in the U.S. Question: what is the magnitude of variability in the patterns of care in patients with ST elevation myocardial infarction, STEMI, by hospital performance, location, or primary percutaneous coronary intervention, PCI, volume, and their association with outcomes? Findings: results of this cross-sectional study, including 73,826 patients, revealed significant variability in achieving treatment times among patients with STEMI across the U.S. Hospitals with lower performance had worse metrics and outcomes. However, outcomes were not different based on location or primary PCI volume, meaning results suggest that despite extensive evidence supporting timely STEMI treatment and established national standards, coordinated strategies are needed to enhance the adoption of these benchmarks with targeted local interventions to address system-based challenges. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Morbidity in males with 45x/46 XI resembles the morbidity pattern in Turner syndrome, a national population-based study. Context: few studies have reported on males with 45x/46 XI mosaicism. Most studies stem from pediatric settings, and knowledge of natural history and long-term health outcomes are therefore lacking. To describe long-term health outcomes in males with 45x/46 XI in comparison to the general population, conclusion: 45x/46 XI mosaicism in males impacts long-term health significantly. The morbidity pattern includes a wide range of diseases, most known to occur at increased frequencies in Turner syndrome. The study underscores the importance of identifying these males and following them with systematic screening as in Turner syndrome. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Low intensity versus moderate intensity anticoagulation for venovenous extracorporeal membrane oxygenation. Background: bleeding is a common and sometimes fatal complication of venovenous extracorporeal membrane oxygenation, ECMO. Whether lowering the intensity of anticoagulation during venovenous ECMO is safe or effective is unknown. Research question: is a large multicenter randomized trial of low-intensity versus moderate-intensity anticoagulation during venovenous ECMO feasible? Interpretation: our results indicate that enrollment and separation between groups are feasible in a multicenter randomized trial of low-intensity versus moderate-intensity anticoagulation for critically ill adults receiving venovenous ECMO. A large multicenter randomized trial is needed and seems to be feasible. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology, Thresholds of Kidney Function Decline and Congestion Status, and their relation with outcomes among discharged heart failure patients. The optimal balance between decongestion and kidney function preservation remains uncertain in outpatients with heart failure. Improved congestion is generally associated with lower mortality risk with eGFR declines, and only higher risk when eGFR exceeds 40%. Here are the articles from Kidney International Reports. A new prognostic score based on cell-mediated immunity for cytomegalovirus infection after transplantation. Introduction. The interferon-γ, IFN-γ, enzyme-linked immunosorbent spot is a highly sensitive immune assay that enables the assessment of cytomegalovirus, CMV-specific cell-mediated immunity, CMI, and can identify at-risk transplant patients of CMV infection. However, its clinical implementation remains elusive. We developed a robust CMV-PrognosTIC score to quantify the risk of CMV infection in SOT, which may be readily implemented in clinical transplantation to personalize CMV preventive therapies. Next article. Self-reported outcome of living kidney donation correlates with perioperative complications, not with surgical techniques. Introduction. The German healthcare system lacks data on surgical complications and self-reported outcomes, SROs, of living donors. The prospective German living kidney donor registry, SOLKID-GNR, aims to improve the assessment of donors' medical and psychosocial risks. Conclusion. Although the surgical technique does not directly affect donors' call shortly after donation, minimally invasive procedures result in shorter hospital stays and a quicker return to work. Self-reported complications have a greater impact on mental call than those documented by transplant centers, highlighting the importance of subjective experiences during recovery.